You're watching Medically Speaking, and I am Meenakshi Upreti. Today, we'll be talking about pediatric cancer. A few days ago was the World Childhood Cancer Awareness Day, a term which many of us don't know much about, perhaps don't even care much about. But it is time that we start a conversation around it, especially when we have all been so consumed talking, discussing just the coronavirus, the variants of coronavirus. This is the time now that cases are on the low. There are other health issues, a very pressing issue affecting our next generation. That's what we will be focusing in the next 20 to 30 minutes from now on. For the same, I'd like to welcome my panelists, experts from all over the country who will shed light on the topic. I have Dr. Sainath Bethan Botla. He is joining us. He's a pediatric hemato-oncologist. He's joining us from the Care Hospital of Hyderabad. I also have Dr. Naresh. He's also on the broadcast with us. He's a consultant medical and a hematologist from Aster Prime Hospital. This is the cancer clinic in Hyderabad. Welcome, sir. I'd also like to welcome Dr. Neeta Radhakrishnan. She's an associate professor, also from the Department of Pediatric Oncology, and she's a postgraduate from the Institute of Child Health Government of UP. I'm going to start with you first of all, Dr. Sainath. Help us understand, sir, shed a little more light on what exactly is pediatric cancer, the number of patients, what really do the statistics say, how many children are affected with pediatric cancer in India, and why should any of our viewers perhaps even talk about it today?
So just to have a broad picture, how common is the problem and how serious and important it is to address this is pediatric cancers are one of the highly curable cancers as compared to the adult cancers. So that is why we should actually to create more survivors from this dreaded disease. Second thing is they constitute around 5% of all the cancers which occur in India. And just to have a 3 to 5%, just to have a very clear idea, we diagnose around 1 million cancer cases a year. So even if you say 5%, it's a very significant number of pediatric cancer patients. And in the entire world, among all the kids with cancer, Indian kids constitute 20%. So on percentage wise, it might look small, but when you look at the exact numbers, we are diagnosing around 50 to 60,000 kids with cancer every year. And our survival pediatric patients with children with cancer, the survival rates have been just around 50 to 60%. And there's way more ground to cover.
So you've covered the basics for us, sir. Let's take this conversation further. Dr. Neeta, tell us really, now that we know that there are a large number of children within India who are affected with pediatric cancer, the survival rate is so low. Let's start with the basics for our audience. What causes pediatric cancer? Is it just genetic, or can there be other reasons as well, ma'am?
Thank you, Meenakshi. So this is a question that all parents ask us, that why did this happen to my child? Did I do something wrong, or did I feed the child improperly? Why did this happen? So this is first and foremost, pediatric cancers are not primarily because of any genetic issue. There are few cancers which are related to genetic predispositions. That happens probably in around 10% of the cancers, maybe less than 10% of the cancers that we see. The vast majority of children who come with cancers they get it because without any reason. It must be a reaction of the body to an infection or a chemical or some other exposure the child has had. But unlike in adult cancers, we do not have a etiological factor. In adults, we know if you stop tobacco, if you stop alcohol, or if you do screening early, we can prevent cancers. Like that, you don't have anything in a child. Like you can't say, tell the parent that if you do this, your child will never develop a cancer. So it's usually an idiopathic cause, as in there's no reason to it. But a lot of things have been tested, but we don't have one single agent to tell that it is because of this. And in few families, it is because of a genetic reason. Yes, Meenakshi.
Right. You said in a few cases it's genetic predisposition. In a lot of cases, there can be a plethora of reasons ranging from exposure to chemicals to many others. Dr. Naresh, to come in the conversation here, sir, is there anything which a parent can do perhaps from the time of pregnancy or when they have an infant at their hands to prevent pediatric cancer, or is there nothing which a parent can do? Anything, any tip or anything which you'd like to, tell the parents, very worried parents who could be watching our telecast today?
As ma'am told, many of the reasons for pediatric cancer are unknown, only less than 10% genetic. So, like we have one type of malignancy like retinoblastoma. It's an ocular tumor. So it may bilateral retinoblastoma might run in families. So if you have a kid or child before that, so they might be should be conscious. So we have some tests like RBG and all, so that we can test it. And other some infections, some known like HIV, EBV, are some infectious agents which have a causative agent for pediatric cancers, but a vast majority are unknown.
The last, as you said, the reasons could be unknown, Dr. Sainath. But when we discuss preventive measures, the question really was: are there any preventive measures which the parents can take, or is there nothing they can do at all, sir?
So when we don't know what causes most of these cancers, I don't think we have an effective preventive strategy as well.
Correct.
See, the most important barrier in this disease is completion of treatment, getting to the treatment facility early. So as such, there is no specific strategy or a way of life which we can advise to prevent cancers in kids.
But if someone is detected with cancer, what should be the first step? How does a parent even know? What are the telltale signs which one should watch out for, sir?
Yeah. So most importantly, if you look at the most common symptoms, just like in adult cancer, any swellings in the neck, any fevers which is not getting resolved by antibiotics or these things, any headache or any vision abnormalities, or any weight loss or inability to gain weight. These are like very soft and subtle signs which can point to an underlying malignancy or what do we call cancer. So the first point of contact is the pediatrician getting evaluated and doing certain simple blood test kind of things where there would be a pointer towards is the child suffering from cancer or not.
Dr. Neeta Radhakrishnan, help us understand the significance of early diagnosis, because that's something which I believe all of you seem to be hinting at. Help us understand how significant is early diagnosis and how does it help in the treatment, ma'am?
Two ways. Because we don't have a preventive strategy, the only thing we can do is to diagnose them early. The advantage of diagnosing early is that we are picking them before it goes into complications. So for solid tumors, we are picking them at an early stage of the disease. And for leukemias as well, hematolymphoid malignancies, we are picking them at that stage where it has not gone into too many complications. So when you pick them up early, the second advantage is that you can treat them with lesser treatment and your prognosis improves anyway. You pick them up early, your chances of survival improves significantly. If you pick them up very late, then by then already the disease has spread all over or complications have set in, then the treatment becomes difficult and we may not even get the desired results. So that is why early diagnosis is of utmost importance. And there are some signs which we have been teaching all our colleagues, our physician colleagues, pediatricians, general physicians to pick up these things in children so that they can be referred early or they can be evaluated early for a diagnosis.
Right. And Dr. Naresh, why is the rate of survival rather low till now in pediatric cancers? Is it because there is a lack of early diagnosis? Because the telltale signs, as I can understand from a layman's point of view, also seem to be quite subtle.
Yes, I would say there are a couple of reasons for a poor survival in our country, especially coming to the late presentation to healthcare facility, because there are multiple due to lack of awareness, education, the social administrators, and availability of alternate or any medications. And in coming to the delayed diagnosis, so in type 2, type 3, especially the majority of population lives. So the proper diagnosis, because these are some expert tests, like for leukemias, we have immunophenotyping flow cytometry. So these are present in like high volume centers or digest centers. And for solid, like any CNS tumors, we require MRI or brain imaging, which are not available at our type 2, type 3 centers. and also the lack of expertise for diagnosis. We need interventions like solid. We need biopsy, ultrasound biopsies, and CT biopsies may be required for diagnosis, and bone marrow aspiration biopsies. So these are some diagnostics which are currently less available expertise at the Tier 2, Tier 3 cities. So, and also due to late presentation, they present in advanced stage. We see silent malignancies. So, advanced stage generally the survival is late because in this present at early stage for lymphoma, we will treat with chemotherapy, and other solid tumors, we have a surgery is the first option for tumors. And also, we have in our country, so TB is a majority. We have high prevalence of TB. So generally, empirically, they find a lymph node, anything, they start treatment. And also they start steroids, so which may interfere with our diagnosis and delayed diagnosis. And coming to the treatment also, it is a we have treatment options at our expertise center, because at Tier 2, Tier 3, the availability of blood products, because we have a high burden of like malnutrition, infections, they play a big role. They all come into the supportive care. And also we have treatment abundance, like appointment. Many people there, because the treatment is around for leukemia is around 1.5 year to 2 years. It's a longer treatment. So adults becomes an issue.
In between. Okay, so you did touch on a lot of topics. One, of course, completion of treatment, how paramount it is. Again, detection, how it is difficult. But let's first focus on the infrastructure. Dr. Sainath, help us understand. We already all know about the rural-urban divide. In rural areas, of course, pediatric ICUs, the technology which is needed, there is certainly a lack of it. We know about it, but help us understand, where does the infrastructure stand as far as the country is concerned? And is it the lack of infrastructure as well? Is it the lack of technology as well, which is leading to a higher number of mortality in pediatric cancer cases in India?
So, to answer your question very discreetly, first thing is the survival rates for pediatric cancers in the West is 90% compared to 50 to 60% in our country. So why are we unable to match their standards is obviously the availability of number of pediatric hemato-oncologists to treat this disease, and most of them are largely confined to the urban centers. Yes. Now, having said that, the biggest barriers to treatment is one, which I think it was addressed by Dr. Neeta and Naresh, is the early referral, first one. Second thing is the compliance. So sometimes when kids come with cancer, come for treatment to stay in the urban center for say 4 or 5 months or sometimes 6 months, it also amounts to loss of work, loss of wages for the parents.
So you've muted yourself. You've muted yourself by mistake, I think. Yes, please.
To finish the treatment, that's one of the biggest barriers. So it's not only the medical aspect of it which has to be addressed. It is also the social aspects of it which has to be addressed to treat this disease. Obviously, definitely the infrastructure also plays a role. We need more.
Okay, so number of doctors, is there a lack as well, Dr. Neeta? There is a lack, of course, of number of doctors, which is also leading to the higher mortality rate. The difference between what we see in the West, recovery rate vis-a-vis India, certainly seems to be quite large. That gap seems to be very, very large. What do you think we can do? Any suggestion for the Indian government as well to somehow bridge this gap? End of the day, it's the life of children we're talking about.
Yeah, so we could work on many aspects, Meenakshi. One is the fact that, like it was mentioned, infrastructure or facilities where treatment is possible. So rather than building new facilities, strengthening existing facilities, strengthening medical colleges would be the easiest way to go, because already in every state there are government and private medical colleges where there are trained pediatricians already there. And so if this could be added as a if this could be added as part of that. Like already there are many centers which are already treating children with cancers in many medical colleges. But then over the years, trained doctors are also increasing. So overall, there has been an improvement in that aspect. From what it was like 10 years back, we have definitely seen better trained doctors who have come in. Sorry, I didn't get your question.
What do you suggest? What more needs to be done?
So what needs to be currently awareness, that is one aspect. There's a lot of stigma around it. So in the part of the country that I treat, there are many families who are willing to give up treatment just after hearing the name cancer. So there is a lot of stigma around it that needs to be addressed, that they have to be reassured that if we put in our best efforts, the chances of getting the child out of this condition and the chance of living a cure. We are talking of cure, unlike in adult malignancies, where it's always a time point that we are talking about, 5-year or 10-year survival. Here we are talking about a normal child who's going to come out of the treatment and going to live life like any other child, going to school normally, getting into a profession, having a family life, everything normal as any of us do. So over the years, the awareness part has improved, but there's a lot to work on. And second is, if we have some kind of a government policy to treat, like currently, if a child is diagnosed with thalassemia, for example, that's another chronic illness in our country. So thalassemia patients, straight away, there's a policy. If you have a diagnosis, there are these centers, there is this treatment, this is the standard of care. There is something which is already written out. That kind of a policy is not there currently. A lot of centers and a lot of doctors in our fraternity is working for it to get to a uniform treatment strategy, uniform way of how a child, whether the child is in Karnataka or in Hyderabad or in UP, the treatment should be similar. So that is something which we can work on. And with the universal healthcare like Ayushman Bharat, which is being provided, that is a great way of, and Ayushman Bharat covers these diseases also. This is a way to
is, ma'am, but the insurance cover which is provided, Naresh, is it enough to treat a child? What is the cost which a family ends up bearing? Obviously, the different type of cancers, different stages and different treatment. But I'm just asking a ballpark figure because many a times it's the expense of the treatment which is also a deterrent for families.
Yes, as you told, the finance is a utmost problem for especially coming to the malignant cases like we have in solid and both leukemias, and also there are multiple complications if you come to leukemias. So along with main treatment for leukemia, we need a treatment for support for infections is the most common, and also for blood support is important, like platelets and all, PRBC. So, and also the stay, because it's a burden for family, as Sir told, they have to lose the job wages and they have to stay. So, so the cost of the treatment depends on the type of cancer. For leukemias and the solid, it differs, and also the duration of treatment.
Right. You said the duration would differ, the cost would differ, but Dr. Saina, the ballpark figure, how much would a parents end up paying for a treatment? And I ask this because is the money given under Ayushman Bharat generally enough? Because if a family has an income issue, once the insurance cover gets over, it is likely that they may pull out of treatment, which you said is a major issue. There are many families which you all of you seem to be saying who pull out in the middle of the treatment, perhaps due to many reasons. Economic reasons seem to be the number one deterrent.
So economic reasons as a reason to discontinue treatment would be a very low number actually to speak, because most of the drugs used to treat pediatric cancers are cheap. It is the cost of the supportive care and staying at the center which actually add to the economic costs. So the entire treatment, whatever the Ayushman Bharat has the capital of 5 lakhs, it actually covers for a poor child. What it doesn't cover is the social cost, the loss of wages, the time which the parent has to spend with the kid, the transfusion, the blood transfusion supports, all which actually add cost. So if none of these schemes are there, if someone has to pay out of a pocket, depending upon the complications, how early the child has to come, it can range somewhere between 50,000 for a month of treatment to somewhere around 6 to 7 to 8 lakhs in any of the big hospitals where the patient is paying out of the pocket. And most of this cost is towards the supportive care, antibiotics, blood support, staying in the hospital, lines, investigations, not the chemotherapy drugs per se to treat pediatric cancers. They are in fact actually, if you want me to give just a ballpark figure, the drugs which are required to treat the most common pediatric acute leukemia, acute lymphoblastic leukemia, a month's treatment, probably you can easily cover it under 8 to 10,000 rupees, depending upon this one. The additional cost of the care, transfusion support, hospital stay, loss of wages, these all add. So we can actually have a program and a support from the civil society to address these aspects of the care and actually improve our cure rates, irrespective of the socioeconomic status of that patient.
And perhaps that's why we have discussions and programs like these to raise awareness, of course, to raise the consciousness of those who can come out and help those in need. I'm running out of time. I can just take a question or two from the other panelists. Dr. Neeta, your concluding argument, ma'am. We have discussed the causes. We have discussed the treatment. We have discussed even the cost of the treatment, perhaps even a possible roadmap suggestion which you set for the government. Anything you'd like to tell the parents and also the primary point person, which is a pediatrician, because again, what comes to my mind is that detection doesn't seem to be very easy, because for a toddler, for an infant, they cannot express what they're going through, and many a times the signs which you had spoken about are a little subtle for even a pediatrician to detect immediately and raise alarm over.
So I would like to thank you, Meenakshi, for taking up this topic, because it's such a rare condition, and so most pediatricians are not aware of it in their training. But nowadays the system is improving. So what I would tell parents as well as physicians and pediatricians would be, if there is a child who is having fever which is not improving, you think it is malaria, typhoid, or common infections, and it's not improving, definitely keep malignancy as a differential diagnosis. If a child has a lymph node, if you think it is tuberculosis, if you don't have an evidence that it is tuberculosis, but many centers start on tubercular treatment upfront, even if there is just a lymph node, there's no TB mycobacteria which are seen, even then people start treatment. So we lose a lot of time in all these processes. By the time 1 month, 2 months go by, then they realize it's not improving. It's usually the disease would have spread. So lymph nodes anywhere, masses anywhere in the abdomen. If child is looking pale, child is having low platelets, child is running high fever, always evaluate. That's the
last question very quickly, Dr. Naresh. I have about 30 seconds for you. Difficult, of course, to even get a child to go through such a long period of treatment. Any tips you'd like to give? How can parents ensure that children cope up with the treatment, their mental health doesn't get affected due to the same?
Yes, the cure rate is 90% majority of the probably treated in pediatric cancers compared to the adult cancers. So we may counsel the patients at first entry only. It is a curable condition. If the treatment is given at a correct time, and the duration of treatment should be taken proper. The duration should be properly, and we can educate them, and we can tell them what is duration, and we'll counsel them. Proper counseling and proper educating the patients would be a plan. Would be a good for patient compliance. So that he or the patient will complete a treatment, it should be increase the cure rates.
All right. So completion of treatment, early detection key here. The idea is not to create panic. The idea is to raise awareness. We hope that policymakers, we hope that corporates, those who indulge in CSR activities are listening. We hope that there is a fundraising program as far as treating pediatric cancer is concerned. A very pertinent topic. Yes, the number of those affected may not be as many, which raises a major alarm, but certainly it's a point to ponder about. It's a day to raise awareness over this topic. Hope we have contributed in a small way rather towards the same. I'd like to thank all my experts, all the doctors who've taken our time to speak to us on NewsX. Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.